in order to provide that appropriate public education, your child's IEP team or instructional team should have reviewed your child's IEP and should have asked, can this whole IEP be implemented remotely? Can it be implemented? Can it be implemented remotely? Can it be implemented with some changes? What are those changes? Well, one of those changes is remote versus in person. But are there things about that IEP that are impossible to implement unless you're actually in person? So an example that might sound kind of silly, but it's illustrative, is if your child has on his or her IEP or their IEP medication administration during the course of the school day. Your child goes to the school nurse to get medicine. Well, that can't happen if your child's not in school. So that's an amendment that would need to take place in the IEP. There may be other things that just simply require the presence of your child in the school building or face-to-face interaction between your child and a staff person that simply cannot be implemented remotely. And that's the kind of thing that in guidance from the State Department of Education, clear, those are the things that would require amending an IEP to maybe set aside until schools reopen. But the academic goals and objectives related to this are to be implemented to the extent possible, but just implemented remotely. So the teams were required to go through this process and figure out what changes might need to be made in order to be able to implement those goals and objectives, and then to implement that IEP. Most districts, and Howard County is one of them, made a separate document and called it a continuity of learning plan, because the State Department of Ed required continuity of learning, and kids without disabilities were getting these continuity of learning plans. So kids with disabilities also got these plans, but what they should have been, and hopefully are essentially the amended or modified IEP. If you disagree with those services, you should have the opportunity to request an IEP meeting. So if there are questions about that process, I can address them a little bit later. I mean, everybody's been in this process for a couple of months, but that process may not be over. So, so we can talk about that. But now we're 2 months in. So, where are we? It's kind of time to reevaluate IEP implementation and student progress. You're well into the 4th quarter. School's going to be ending. So you have to look at, is there a need to adjust those supports, those services? How has your child been doing? We know that data are really critical, and one of the things that should have been happening was the school staff should have, in developing the amended IEP or the continuity of learning plan, should have talked about how progress would continue to be monitored and how data would be collected. And this, I think, is a challenging issue because I think with families having a lot of the burden or a lot of the responsibility for implementing these distance learning plans when their child's not sitting facing the screen, or even to support their child in looking at the screen. It feels like parents are responsible in a lot of ways for the progress monitoring. And I want to stress, it's still the IEP team's responsibility to monitor progress, but it is also, you have a role as a parent in collecting data, but you can do it in an informal way. You know where your child was in March when school closed, and you know where your child is now. And hopefully you have kind of been keeping some tabs on what's been happening from then till now. And if not, you can start now. Just like keep a journal or write notes or video if your child has behavior issues and has a tantrum. You might want to video a little bit of it. You just to, whatever it is, to just kind of keep some markers of your child's progress or lack of progress. That when you come back to the team and you have a discussion about where your child is and what services may be needed, um, and what those services are called, we'll talk about in a moment, you will have some landmarks along the way, some milestones, some markers that will help you figure out and talk to the team about what's happened with your child from mid-March until you sit down with the team. So, so that baseline is important. If you didn't write it down, but you remember what your child was doing, write it down now. But still remember that it is the school system's responsibility to conduct the progress monitoring because that's part of the IEP requirement when the team is looking at how to measure progress. It's the team's responsibility to do that. If you think that there may be changes needed to the continuity of learning plan, the data can help you support your argument for changes. And you can ask for an IEP meeting at any time to discuss the continuity of learning. So really, you can use that information that you collect as in an informal way, and you can use the progress monitoring the school system is doing. So when school resumes, the IEP team is going to have to determine whether and to what extent your child has experienced regression or has not made progress, or if your child has made progress. And that's going to spark a discussion about compensatory or makeup services, or we can call them. I'm sorry, that's my phone ringing. I can't get it.
Oh, is that you? Okay.
It is my home phone. It's
That's all right.
my house. So the team is going to have to look at, and so we call it compensatory services, and that's a laden term, and we haven't really found a good term yet to replace that. But it's the services that will, if your child has regressed or not made progress, it's this discussion about services that will help your child get to where your child should be or would have been had your child been in school. So there may be a need for additional services. There may be a need for different services. Some people are looking at it as accelerated services, accelerated learning, whatever you want to call it. There's going to have to be a discussion, and the data will be critical for that. So the kinds of things that the team will discuss, the kinds of things that you can document are whether there are environmental concerns that promote or interfere with learning. There are families who have multiple kids who are trying to learn at the same time and may not have a device for each child, or there may be limited internet services, or there may be no internet service. The student may not be able to respond to online instruction and services. Maybe some children can't sit still. Some children don't respond to people on the screen. They need a person there. Some people need somebody facilitating their instruction and can't do that online. Looking at the frequency and duration of the services, which goals are being addressed? Are all the goals being addressed? How effective are these supports and services? Is the work being modified the way it needs to be? Are accommodations being provided? So what barriers and challenges are impacting your child's ability to learn or to access instruction? We have families where parents work; they're essential employees. What kinds of hurdles does that pose for children being able to participate in online learning when parents are so key to be able to make that happen? So, so when kids return to school, as they will, I think that we need to recognize that this is not going to be an all or nothing return. Kids are not going to go back in September and or in August and return in a full way. We don't really know yet what school is going to look like. The State Department of Education has issued a draft recovery plan, and there's a meeting next week of the stakeholder group to discuss the plan. I know the Sun just came out with an article about this. School systems will have a lot of leeway about how they choose to structure the return to school, but I think we can pretty much say with certainty that kids will not all return to school at the same time. And when they do, there will be social distancing. So some of the kinds of schedules under consideration by school systems, and I have no idea what Howard County will do, are A week, B week, or having elementary school kids come back and stagger, and then middle school and then high school, or having the kids who need the most services come back sooner, or having part-time. And, there are just all different ways of organizing this. So what does that mean? That means that kids who are not, when they're not in school, will be continuing in all likelihood distance learning. And so these continuity of learning plans that have kind of held your kids for the last 2 months are going to have to be reviewed, because they may not, they weren't really intended to be long-term plans. And if they're not fully implementing your kids' IEPs, there's going to need to be a meeting. You're going to have a meeting to really talk about how can full IEP implementation occur, especially if your child's doing some kind of hybrid program or is not actually returning to school. When children do return, there's going to have to be discussion about health and safety kinds of considerations. If you have children with sensory impairments and they can't tolerate things like wearing a mask, and one of the requirements is that kids will wear masks, that's going to have to be addressed. Kids who need a lot of hands-on, one-over-one hand assistance or one-to-one assistance in toileting or in uh, personal assistance skills, all that has to get sorted out. So lots of kids who have health conditions, who may be much more at risk, decisions will have to be made. Is it safe for them to come back? What does education look like for them? So lots and lots of questions. I don't have answers at this point, and we don't have clear answers in terms of guidance that's come from the state at this point. So as I said a moment ago, the IEP teams will have to meet for each child and talk about whether additional new or different services or accommodations are needed. This additional or compensatory education, don't expect it to be an hour for hour calculation, because it's not going to be. It's not that the school system failed to provide services because of some fault of the school system. This is a very different kind of situation, and it's going to be really important to do an individual assessment of your child and figure out, did your child make any progress, some progress, no progress, if progress, which goals, and then design a program that accounts for that. So the IEP teams are going to have to meet for every child and then design an individualized plan that accounts for the time that kids were not in school getting any services, and then the time that they were getting the distance learning and whatever gap may have occurred because of that. There are issues that come up for students who are transition age. Some of those transition programs include a lot of community.
Aynı yerden mi parayı çekmek istersiniz yoksa başka bir yere mi gitmek istersiniz parayı çekmek
Just remember
için?
to mute yourself,
Yes, if
folks.
you can mute yourself, that would. So there are students who spend a lot of their time in the community, in community placements, and have not been able to do that. While secondary transition plans and activities still need to be implemented to the greatest extent possible, and there is a lot that can happen through online learning and remote instruction. If your child is in their final year of instruction, education, you may want to talk to the team about trying to extend for an additional year or some additional amount of time as part of that discussion about additional services that may be needed. So there are resources at the back, in the next slide. And then some of the questions that came up when you registered, I want to address, and then we'll throw it open because I wanted to leave a lot of time for questions. So one of the questions was, is the school system, and I've heard this a lot from a lot of people, is the school system obligated to provide the specific intervention or methodology through distance learning that my child was receiving in school? There isn't guidance about that, and there's nothing in the law because, of course, the IDEA doesn't address, the Individuals with Disabilities Education Act doesn't address this issue. But in talking with some of my colleagues, I think we would say no. There's not an absolute right to the same methodology, and in general, parents don't have control over the methodology. That it's the school system's decision. What I would say though is if your child is not benefiting from the methodology that's being used for distance learning, that's an issue to raise with the IEP team. So you may not have a right to the same intervention your child was getting, but if that intervention they're using is not working, that's an issue to raise through an IEP meeting and discuss, is there a different way of providing the services? So another question that came up is, what are the ramifications if my child's disabilities prevent participation or full participation in the distance learning program proposed by the school system, or if I'm unable to support my child to participate? And I think that's an important question because, as I said, some parents are essential employees, or they have other kids, or there are other things going on, or children are not able to sit at a computer and participate fully in the program. And again, although there's not specific guidance from the state, what we want to make sure is that when the teams meet to talk about the services that may be needed to address this period of time, the children are not penalized for the fact that that they may not have been able to fully participate, or that their families may not have been able to fully support them. So we have asked the state to issue some guidance on this, where we will ask again, but we want to make sure if that looks like it's happening, that would be a nice advocacy issue to contact the Autism Society or our office about. So we don't want that to be a barrier to kids getting the services that they need. Will there be fourth quarter progress data, and should we expect to have meaningful annual IEP meetings? There have been annual IEP meetings happening. The timelines still run. I've attended IEP meetings for clients, and they've been, they have been meaningful and substantive meetings. And yes, there should be fourth quarter data. It's not going to look the same as it would look if your child were in school, but it should be based on the data that should be being collected by the school staff who are providing the online virtual programs to your children. And then if you have additional data, you may also want to make sure that school has that as well. Because if you're with your child and you have additional information, you may want to share it with the school. But whatever, they should be collecting data while they're working with your child, and that will be the data that they would base this on, base their report on. Yes.
Leslie, one follow-up on that in the chat box. For people that are getting progress notes or perhaps an annual IEP back, that kind of a draft of it, and it says data is insufficient at this time, and obviously that's because of COVID and the closure. Should parents have the expectation that data will be or should be provided for the goals that were included in the continuity of learning plan? So the specific goals, or objectives that could be some data on those?
Yes, there should be. I mean, if whatever the continuity of learning plan has included, the school should be collecting data on that, and it should be being included in a fourth quarter progress report. Something should be happening in this interaction between your child and school staff. It's just happening online rather than in person. But there still should be, if there is individual instruction, individual therapy, group therapy, whatever is group instruction, there's an opportunity to collect data, and that should be happening, and then you should be getting that progress data. And that is part of what should go into the discussion about what services your child needs as you come back to the table. And if you're not getting that data, then your own information, you can call it data, you can call it information, you can call it your journal. I mean, whatever you're keeping in an informal way to document how your child has been doing from March until school resumes will be really important, because if the school system's not producing that data, they're not going to be able to counter what you put in front of them. So if you haven't been, I would really urge you to start keeping a journal, jot notes every couple of days, once a week, however you want to do it, but just to mark when your child is it doesn't even, when your child is doing online learning, what's happening? Are they paying attention? Are they not paying attention? Are they engaged? When you're working on, when you look at that IEP and you look at the IEP goals, did your child have 12 vocabulary words and now has 5? Was your child using a communication device and now hurls it across the room? Is your child doing, now has 20 vocabulary words and had 5? Spending hours and hours with your child, working with your child. Those are the kinds of things that, it has your child regressed or made progress behaviorally. To go through the IEP and really look at each of those goals and just jot some notes that will jog your memory. If you're at all like me, the days start to blend together, and we're all, we all need haircuts. We all like everything's just sort of blending, and it's really hard to go back and say, oh yeah, the middle of March, my child was doing this, and by the middle of April, my child was doing that, and now it's the end of May, and we're here, and in June, July, it's just like those notes will help you, and they'll be the markers along the route. September now feels like kind of a long time away, so just a few words or something to help you just keep tabs, and in the interim you can always ask for an IEP meeting. Okay, so I hope I've addressed that. So another question, and I hit on this a little bit earlier, is when schools reopen, what will happen with students who, because of their disabilities, are unable to practice social distancing or wear masks or take other preventative safety measures? We don't know. We don't know if there's going to be guidance from the state or if locals are going to be on their own to figure that out. There may be things that have to be placed in an IEP. Children may need additional services on their IEP to teach them how to do these things that nobody's ever thought, nobody ever thought would be necessary. Parents may need additional training. You may need parent training on how to collect data, or how to prepare your child to return to school. This is really traumatic for families, really traumatic for kids to see their routines disrupted this way. And they may need some support in preparing to return to school in a very different way than they left it. So there may need to be some transition back to school services that will need to be added to the IEP. Maybe you'll need social stories for kids. Also, so be thinking about what additional services might be needed just even to get back into the school building. Right, and I think I addressed this earlier. Will distance learning continue when schools reopen? Yes, in all likelihood, in some form. And if so, will my child's continuity of learning plan remain the same? We would argue, unless the learning plan is implementing pretty much the whole IEP, it will need to be revised. So now I know that I've seen things flying across the chat box, so I know that there are other questions that people have, and I'm happy to answer what I can.
Yep, I'm going to just feed you a couple that have come up, and please keep in mind, parents, that some of the questions are really specific and better addressed by Howard County, by the Department of Special Education. So if you have specific questions about why aren't they doing more of X, Y, Z, and why aren't they, why isn't my teacher online more? Those really are questions that would be better addressed by the Department of Special Education, since they are specific to what Howard County is providing and the school system's continuity of learning. So some of those questions we couldn't answer. We can't speak for the school system here, and we can give you advice on who to call, and we can give you advice on how to ask the questions. But some of these would be more specific for the Department of Special Education. And you are welcome to reach out to them directly. I will definitely include their contact information on the end of the PowerPoint when we send that out to everyone, so that you're able to access that. So one of the first questions that came up, Leslie, was if a parent disagrees with how much with the continuity plan, the reduction in goals, for instance, a child has 4 reading goals, but only 2 were included in the continuity of learning plan. Is that reasonable, or could a parent ask for additional goals to be added?
That's a really good question, and I think it's actually the State Department of Education has put out a number of guidance memoranda, very, very helpful to read. And the main one that addresses instructional services for students with disabilities makes very clear that in designing this continuity of learning plan, you start from the premise that the entire IEP is to be implemented, and only if it can be. And that what may change is how the services are implemented, because they're being implemented remotely rather than in person. But that only if a goal or an objective cannot be implemented remotely, do you then amend the IEP, which can be done outside of an IEP meeting if there's agreement. So my answer to that is that what should happen is all 4 of those reading goals should be being implemented. And this kind of picking and choosing is not okay. That unless there is some reason why 2 of the goals are not implementable, just invented that word, cannot be implemented in a remote way. And so it shouldn't be that you have to go, beg or ask, or that it's unreasonable to ask for the other 2 to be added back. It should be the IEP team's burden to explain why it is not possible to implement all 4 of those goals, and then have a discussion about why that's not possible, and then if you disagree, to convene an IEP meeting to revise the IEP.
Okay, so thank you. Another question, and I just want to clarify, if a parent does not agree with the continuity of learning plan, if they don't remember agreeing to what is on it, but they got this document that says they agreed, at any point a parent can request another conversation with their case manager to discuss the continuity of plan, and if necessary, call an IEP meeting. Is that correct?
Yes, that is correct. So let's talk a little bit about the amendment of the IEP process. The law allows IEPs to be amended outside of the IEP process if the parent and the school system agree. So if the school system proposes a continuity of learning plan or an IEP amendment that you agree with, that's fine. They can do the IEP amendment, and that's fine. And you actually don't need to sign it. Signatures are not necessary. If you don't agree, then it should trigger an IEP meeting with the full notice and prior written notice after all the procedural safeguards. You always have the right to, the same way you do if you had an in-person IEP meeting. If you decide that you're not happy with the plan or you think it needs revision, you have second thoughts, you can ask for, you can try an informal conversation first. I know that you're suggesting going to the team leader, and that's fine. Or you can ask for an IEP meeting to discuss revision to the continuity of learning plan. And I want to call it the amended IEP because really, when you look at the State Department of Education guidance, they did not talk about, and in fact, discouraged creating a new document. What they talked about was amending the IEP, and every district went off and created a new document they called a continuity of learning plan. But for kids with disabilities, that continuity of learning plan should be the IEP or an amended IEP, not some totally different document where they pick and choose IEP goals the way that they do for ESY. It's not, this isn't about figuring out critical life skills and maintaining progress. This is about implementing the IEP unless it is absolutely not possible to do it remotely. And I think there is everywhere a real gap between what is supposed to happen and what is actually happening. Not everywhere, and not for every kid, and in every school. I think there is a lot of inconsistency.
Okay. With regard to ESY, for students for families that had their ESY discussion determination meeting, and it was determined a child was not eligible for ESY before the school closure. And now a parent feels there's been significant regression and the child would be challenged if they were to return to school to kind of close that gap. Could the parents request a redetermination meeting for ESY?
Yes, I mean, parents can always request a meeting, and they certainly could. I think it gets a little bit tricky because the state, based on federal guidance, is making a very clear distinction between regression or the circumstances that might warrant compensatory services because of the school closures and ESY. And the State Department of Ed has issued guidance about ESY. I think that this is an individual, this has to be an individualized decision, and so it's hard for me to just give a blanket answer, except that I think there is definitely overlap, and it's confusing, and I think parents should certainly feel free to ask for a meeting and have the discussion with the team. And certainly if the team continues to say no, parents should ask for prior written notice and get full documentation of the reasons why, and then certainly raise the need for those make up additional different services when that meeting happens in the fall.
Okay. Leslie, with regard to some of those additional services that parents may feel their child needs when school returns, if we have a student, and we've heard from many parents who have kids who simply cannot participate in online learning without an adult sitting next to them the entire time, and parents are working and not able to do that, they want to hire somebody to come into their home to support their child for the online learning time. How do parents raise this concern with the school system? What can the school system do to help with that? Could parents ask for the school system to assist in some way with that? Should they keep track of the cost to them to be able to do this? I mean, what advice should we be giving parents on this? It's real for a lot of families.
Yeah, I know this is a really significant issue. Again, there's not guidance in education about this, and I'm gathering there isn't any local guidance either. I'm a lawyer. I always advise people to keep documentation. So absolutely, I would advise families to keep a record of any expenses that they incur as a result of this. If families have had to go out and buy a device, if they've had to, if they've hired somebody to come in and support their child for instruction, I mean, not for childcare, but for instructional purposes and to facilitate participation in distance learning. If families who have had to increase hours for behavioral support and they have to pay or increased therapy expenses, all of those parents should keep a record of. I'm not saying that they're going to be able to get reimbursement, but unless you have the record, you're certainly not going to be able to get reimbursement. So I would definitely keep records, and I think it's also helpful. Goes back to the documentation that we talked about earlier. So you're keeping a record of your child's progress. If your child has stayed on track and has maintained or made progress, it may be because you have supplemented and provided services, and that will be an important part of networking. Will people be able to get reimbursed? I don't know, but I do think that it's important to raise that with the team when the team proposes something. If it is not feasible, if it's not possible, that's a discussion that you need to have with the team members, because otherwise it's not. It's the plan, and if it can't be implemented, then it's pointless. The whole idea is to come up with a distance learning plan or a plan that can be implemented. So there has to be discussion about how the school system can ensure that your child gets IEP implementation in some form or another. And if distance learning is impossible, is there another way it can be provided?
Thank you. For some families, they're actually finding that their kids are benefiting from being at home, and for various reasons that they're doing better. And for those families that are considering, we don't know what the fall will look like yet, we don't know really how kids will return to school, but let's say kids do return to school and the child does better at home and parents want to switch to homeschooling. Can you just speak to, in general, if a parent is providing instruction at home, what IEP services are provided to those children?
So if families choose to homeschool, they withdraw their child from the public school system, and so they're not entitled to IEP services. So it's not a decision to take lightly. If you have a child with a disability, it's not decision to take lightly in any for any child. And there are requirements the State Department of Ed puts out about what you have to meet in terms of curriculum requirements. So I always advise families that are considering homeschooling their children to contact the State Department of Education for information about all the requirements and make sure that they are able to implement those before they make the decision, and know that it's similar to but not the same as privately placing the child, in that you are privately placing on your own kind of school, in that you're withdrawing your child from the school system and choosing to educate.
Great, thank you. Another general question, this doesn't really have to do with the pandemic, but it's a good question, since many families will be getting outside evaluations, since there are practitioners that are still doing assessments. If a family has an outside evaluation from KKI or another practitioner, and they want that evaluation to be considered by the school when they reopen and decisions are being made about placement and supports and that kind of thing, at what point do you advise parents to provide that to the school? Should they wait until we're talking about what school will look like in the fall? Should they provide those kind of reports now to the team? Can you just speak to, and can you also advise or let parents know what the school system's responsibility is to consider outside evaluations?
Right. So the law requires that teams consider privately obtained evaluations. Parents always have the right to get evaluations from outside of their own expense, but it doesn't define the word consider. So what does it actually mean? It means the team has to take a look at that evaluation, and they have to talk about it, and they have to discuss whether they agree or disagree with the content of it, whether they agree or disagree with the recommendations of that evaluation. If they disagree, and a parent's asking that those recommendations be adopted, if they disagree, the team has to document in prior written notice why they disagree, what they're relying on and disagreeing. Any decision that the team makes, that either anything they're proposing, any action they're proposing to take, or any action they're refusing to take, they have to document in what's called prior written notice. So they have to talk about why they've made the decision, what they've relied on, all the assessments, all the documents that they've relied on in making that decision, what other alternatives they considered, why they rejected those other alternatives. That's all prior written notice. So if they choose not to agree with an assessment, they have to provide that full explanation. So timing, when do you turn over that information? I think that's up to parents. I've never been big on keeping information secret from school systems. I always think it's helpful for teams to have information about a child and share it, unless there's some strategic issue in a bigger context. I think it's helpful for team members to have. And if you are thinking that you might have an IEP meeting over the summer, or you want to revisit the continuity of learning plan, or you feel like there are other amendments that need to be made to the IEP, sooner rather than later is helpful. The same way that, so let me go back for a minute. When we introduced the bill some years ago to ask that to require that IEP teams provide documents to families 5 days before IEP meetings, which now feels so ingrained to people, but that's not what used to happen. There was some pushback about how parents should also be required to provide documents to IEP teams ahead of time. And we beat that back. We said, really, this is about giving parents some additional ability to participate as meaningful members of the IEP team. And you can't do that if you haven't had access to documents until you get to the meeting. So now you get your documents ahead of time. But the risk if you don't provide documents to the school system, and I'm not saying do it 5 days ahead of time, I'm not saying there should be a time frame. It's a courtesy to provide documents to the team. It's also, it prevents the team from saying to you, if you hand them something at the meeting, we haven't had a chance to look at this, we can't meet today. And so we're going to reschedule the meeting, which has happened to many parents who come in with an outside evaluation and the team says, you know, we can't consider this. We haven't had a chance to read it. We haven't had a chance to talk. You know, we can't give this due consideration. So I think as a courtesy, especially at a time when people aren't together, if you have the ability to give an evaluation to them ahead of time, enough ahead of time to let them gather whatever they need to do to talk about it meaningfully, it it's a useful thing to do. And then if they disagree, they have to provide prior written notice. And the chances are, even if you provided it to them closer to the meeting, they still are going to agree or they're not going to agree. And so it gets you anything to hold on to it until the last minute. Answer to a short question.
No, but it's an important one, since many of us do take advantage of outside evaluation. Okay, we're coming up on almost our close. I have one more question that was asked. This is again going back to our conversation about data collection. And I know that many parents are feeling or unsure about what data is really being collected when they are online. If it's not through the program that a child is using where the data is being compiled through Lexia Core or Dreambox, the online programs that students are using. When it is a one-to-one, check-in with the teacher, it's really hard to know what kind of data they're collecting. So what advice do you give parents to really just ask that question of teens, to kind of trust that they really are taking data on even just the amendment, the goals that are included on the amendment, so that when you get to the annual IEP meeting, you're talking about something that's real, that's actual.
I think the best thing to do is to just ask the team, send an email message and say, I'm wondering how you are collecting data. How am I getting you? What are you doing? And you could also frame it as, I want to be helpful to you, and it would be helpful for me to know how you're collecting data so that I can collect it in a similar way at home, since I'm spending so many more hours with my child, so that we can have a uniform way of figuring out if my child is making progress or how my child's making progress. So if you can tell me what you're doing, I'll try and do something similar at home. And then it makes it feel not threatening, or maybe less likely to put them on the defensive. But I don't think you even have to. I mean, I think you just ask them. Say, I'm really wondering, prior to when we end up in our meeting, can you just tell me how you're collecting data? I'm curious.
That's a great suggestion right there. Is for the parent that is wondering in advance of the meeting, what should I expect? Is just put that question out there in advance of the meeting. So when we come to the meeting and we talk about data, how is it that you've been collecting it, so that I know where you got your data points from. So that's great advice. I think that wraps up pretty much the questions that were asked in the chat. And again, we had lots of questions in advance that we kind of put into these. We compiled them and Leslie's addressed them. So thank you all for listening. What we'll do now is we're going to take the PowerPoint that was shown today. We didn't send it out in advance because we really do want to add to it. We're going to put the answers to the questions actually in the PowerPoint, the bottom of the PowerPoint, so that you'll have those answers. We're going to add the questions that we addressed today. I'm going to provide you with links. I put some in the chat box already, especially to the Maryland State Department of Education's, all of their technical assistance bulletins. There are many of them, and they do take some time to read through, but they provide very good advice to parents. They're written, and many of them are written as parents' guides, and so they're very helpful. So please check those out. Our website, the Howard County Autism Society Society's website is keeping all of these tabs up to date. The minute that we get them, we're posting them. So you can always check our website. The first thing that comes up is resources for COVID, and they will take you to everything that Disability Rights is putting out, everything that MSDE is putting out, whether Howard County School Systems puts new things out, we're adding them there, Parents Place of Maryland, CCAC. For those parents that have questions around reading and reading goals, Stephanie Carr from our Special Education Citizens Advisory Committee, she's also the chair of Decoding Dyslexia. She can help parents with that as well. So I will, her email, I'll provide her email in the PowerPoint, but you can reach her through ccacchair@gmail as well. That's on that will be in the PowerPoint. So I encourage you to keep reaching out to us. Keep reaching out to me through the Howard County Autism Society. I'm happy to help you through some of these questions one-on-one, and we'll set times to speak with families. And again, just, thank you so much for joining us today and sending us your concerns so that we can continue advocating for our families.
So, Melissa and Beth, if it's helpful, I can stay on for another 5 or so minutes if anybody has questions that they just want to ask, and everybody else can leave. Would that be helpful?
I think that'd be great. I do see one more in there. And thank you to CCAC who presented this with us as well. I see Stephanie on there. Hi, Stephanie. Beth, you see the other question?
I have a question about summer school and fall. Can you hear me? Eileen?
Yeah. I think we have yours in the chat, don't we?
Same question. So basically, I have to work, and my daughter's being facilitated because I'm not working right now. But what about, are the teachers going to be held accountable for videos at night or something like that I can have her watch later? How's that going to work?
So we don't know yet, because we don't know how the jurisdictions are going to schedule the return to school. And it's going to be jurisdiction, but each jurisdiction is going to be deciding. So we don't know, and certainly there is a recognition that parents work. We don't have answers yet. There is, as I said, there is a meeting next week of the stakeholder group. So what the State Department of Education did was pull together the external stakeholder group that they created for the Every Student Succeeds Act, and they added a few other people and pulled us together a few weeks ago, gave us a copy of their draft plan the night before the meeting, and then we had a 2-hour meeting, and then they issued the report with no changes or their plan 2 days later. So we didn't really have any meaningful input into it, although they put our names on it. But it doesn't address those kinds of nitty-gritty issues. They were pulling us together again on June 1st, and I'm sure that those kinds of issues will come up. I mean, there's certainly teachers who work, it was just the daunting nature of something like an A-week, B-week, particularly if you have multiple children in various schools that might be on different schedules. It's very daunting, and I have no answers for you. I'm sorry.
They just thought that moms were home, not working, and that we had the ability to work from home, and I don't have that ability. And I'm sure there's nurses and doctors out there that have to go to the hospital that can't work from home. So
many people don't have that ability. And I've had, I have clients whose parents are essential workers and have not been able to be at home for the implementation of the continuity plan. So,
and we'll certainly, between CCAC and the Howard County Autism Society and other community partners, we have been meeting regularly with Dr. Savage and her staff at the Department of Special Ed, and Ann Schultz from the Family Support and Resource Center. We're all on these calls to kind of bring forth what we're hearing from parents and make sure that they understand, the stress on parents that aren't able to be online at a certain time in the middle of the day and teaching for 6 hours a day. And, they are absolutely aware of this because, just as Leslie said, many of them are teachers themselves and dealing with the same issue of juggling their job as teachers and their own children and having their own children learn. So we know something's going to have to look different for the fall. I think everyone across the state and nation knows that. But what that is, none of us have answers yet. And I don't know any county that does just yet. So, you know, we'll continue to bring forward these concerns and advocate for something different than what we have right now.
I think what they should do is just make the math teacher does make a video that you can watch later. That's a good suggestion that, you know, maybe it's not the whole class, but the main topic of the class could be a short video that kids that can't do it online with their parents during the day could watch it later. That's the only thing I could come up with.
Yeah, I mean, I think it's really hard. There are parents who work at night. There's studies that show that kids are able to learn reading through distance learning better than math. I mean, so there are so many different factors to consider. I know we have meetings regularly with Baltimore City Public Schools. I'm glad that Autism Society is meeting regularly with CCAC and others with Howard County. I think these are the kinds of things that will get hashed out over the coming weeks and the next couple of months. You know, it's just there are a lot of things that have to get figured out. Transportation has to get figured out. Nutrition has to get figured out. You know, whether cafeterias open, how kids return, but in what way. And it all, you know, it's very daunting, but a lot of smart people are putting their heads together. And I think that the really key thing is that community members and families need to be part of that. Stakeholders need to be part of discussions, and hopefully all the local school systems are including families and other stakeholders in this process, because they can't do it by themselves and they need to have input from folks like you. So so together everybody will figure it out, and you know, we will continue to push for meaningful guidance from the State Department of Education, and then you know, to work to make sure all the locals are providing meaningful guidance at this point. You know, when we look at what's happened in other schools in other countries, there's some guidance that's helpful and some that's challenging. France reopened schools and then just shut down a bunch. So we can take lessons from other places and then try and figure out how to make it.
Can I ask one more question about therapy, or are we done? Sorry, do you have to be done at 3? Can I ask one more question about speech?
Leslie, the meeting ends at 3, but go ahead, Vern, we'll end it here.
Okay, so basically she has teletherapy for
I don't know if
two
it's my
lessons so
internet
far.
or yours, but
She has 2 lessons so far, but the second time it went really bad as far as anxiety, and I'm about ready to cancel the teletherapy and go back to whatever the regular speech was, where they gave me 14 worksheets a week to do with her. Am I going to lose services in the fall? They've told me I wouldn't if I decided not to do the teletherapy. She's only getting 20 minutes out of the hour and a half.
It's important to have a discussion about what's actually appropriate for your child. And if teletherapy doesn't work, then you need to figure out as a team what is an effective way to not benefit from teletherapy. But I would encourage not making unilateral decisions. So it's not that you're refusing services because you're refusing them. It's that they're not appropriate for your child, and the documentation should be there. This is what happens when we do a teletherapy session, and so we need to figure out an alternative. So then it becomes, if it's documented and there's a basis for not continuing that and looking to something else because she is entitled to the service. So how else, in what other way can it be delivered? So, you know, again, my general advice is not to just make unilateral decisions the same way you don't want the school system making unilateral decisions. You don't want to make unilateral decisions. You want the evidence or the data to anecdotal data, experiential data to show why something's not working, and then go back to the team and say, we need to make a change here. This is what's going on, and it's not working.
Okay, thank you.
Okay. So, and the key, as always, is individual. The team has to come up with something that's individualized to meet the needs of your child. Okay.
Thanks.
Okay, so with that, that's a great way to end. And again, Leslie, thank you so much for your time today and for being with us. parents, thank you all for joining, and hope that you have a great rest of the day. The point will be coming out, right, Melissa? Mute, Melissa.
Yes, we've recorded the session. It'll be posted, and then we'll be sharing the slides once they're ready. So thank you guys very much.